detailed description about latest laser technique for piles, fissure and fistula therapy. Thank you.
नमस्कार. प्रुडंट मिडियाच्या हॅलो दोतोर कार्यावळीन तुमकां सगळ्यांक माय मोगाचो येवकार. चवथी पयलींची ही कार्यावळ म्हणजे एक नवी पर्वणी अशी समजूं येता. नवोच असो विशय घेवन आमी आज तुमचे मुखार येतले आनी आमचे बरोबर आसा आमचे अतिथी डॉक्टर संतोष कोप्पळ, जे लॅप्रोस्कोपिक सर्जन जावन आसात. लॅप्रोस्कोपिक सर्जरी म्हणजे कितें, ताचे फायदे कितें, हाचे विशीं भासाभास चर्चा आसतली. ह्या संबंदीत तुमचे प्रश्न तुमच्यांनी आमकां विचारूं येता. ताचे पयलीं आमचे जे आयचे डॉक्टर आसात ही आसा तांची वळख.
डॉक्टर संतोष कोप्पल हेणे आपले MBBSचे शिक्षण बेळगावच्या जवाहरलाल नेहरू मेडिकल कॉलेजींतल्यान पूर्ण केले. मागीर 2010 तेणी डिप्लोमॅट ऑफ नॅशनल बोर्डाची मास्टर्स डिग्री बेंगलुरू हांगासरल्या भगवान महावीर जैन हॉस्पिटलांतल्यान मेळ्ळी. डॉक्टर संतोष हेणे कोइंबतूर हांगासरल्या VGM गॅस्ट्रो सेंटरान असोसिएट GI सर्जन, हुनावर हांगासर कन्सल्टंट सर्जन अशा वेगवेगळ्या ठिकाणी काम केलां. सध्या ते वास्को हांगासर लॅप्रोस्कोपिक आणि गॅस्ट्रोइंटेस्टिनल सर्जन म्हणून कार्यरत आसा.
डॉक्टर नमस्कार. तुमकां पयलींच सांगता की प्रुडंट मिडियाच्या हॅलो दोतोर कार्यावळी निमतान आमी फक्त गोंयचेच न्हय तर देशांतल्या तरेकवार भागांतले वेगळे उलोवपी, वेगळी भाशा उलोवपी डॉक्टर हांगा तुमच्या मुखार हाडले. आयचे डॉक्टर आसात तांची मदर टंग कन्नड आसा, पण तुमच्यांनी आमकां हिंदी किंवा इंग्लिशींतल्यान प्रश्न विचारूं येता, कोंकणींतल्यानूय प्रश्न विचारूं येता. आमचो फोन नंबर जो आसा 24904444 आनी 24904445. ह्या दोना पैकी एका नंबराचेर फोन करून तुमच्यांनी प्रश्न विचारूं येता. जशें हांवें सुरवेकच सांगला की आयचो विशय आसा तो म्हणजे लॅप्रोस्कोपिक सर्जरी, जाका आमी की होल सर्जरी म्हणटा किंवा मिनिमल एक्सेस सर्जरी म्हणटा तो आसा. तर डॉक्टर, you can talk to me in English or Hindi, whichever is comfortable to you.
Sure, sir.
Basically what do you mean by laparoscopic surgery? Let's start with the baseline.
Sir, laparoscopic surgery, it is also called as a keyhole surgery. That means we make a very small incision, for example up to 5 millimeter or 1 centimeter, and we pass laparoscope through this incision, and we make sure the abdomen is free. Then we pass a small caliber instruments, 5 millimeter or 1 centimeter, and through by seeing the interior of the abdomen through a monitor, we conduct surgeries. So this is called as laparoscopic surgery.
So basically laparoscopic surgery म्हणजे एक लहानशा बुराकांतल्यान ती मॉडर्न गॅजेट्स हाका म्हणटा, जशें तांच्यांनी सांगलें की लॅप्रोस्कोप आयलो, तातूंत कॅमेरा आयलो, ही सगळी गॅजेट्स त्या बारीकशा बुराकांतल्यान वतात आनी तातूंतल्यान मॉनिटराचेर म्हणजे स्क्रीन आसता, जशें आमी टीव्हीचेर पळयता त्याच्या स्क्रिनीचेर पळोवन ही सर्जरी करप आसता. बेसिकली इट्स अ व्हेरी ट्रिकी जॉब फॉर वन मोस्ट इम्पॉर्टंट थिंग. कारण डॉक्टर, इफ आय एम नॉट मिस्टेकन, what is right, what is seen as left, correct?
Yes, sir.
So you have to be very technically sound and you should be really expert. म्हणजे हे फक्त शिकून जायना, तर तशी तुमची डे टू डे प्रॅक्टिस असल्यारच तुमच्या ते हातार बसता बेसिकली.
करेक्ट.
कारण हे करप म्हणजे तितकेच म्हणजे फक्त तंत्रगिन्यान असलें म्हणून जायना. जशें हांवें वदोड सांगला की जे रायट आनी लेफ्ट हातूंतलो फरक कळटना तुमकां बरेंच कन्फ्यूज जावपाक जाता. जशें आमी केन्ना सादें जर आमगे सादें पावडर लायता किंवा आनी कितें करता, जसं वी गेट लिटल कन्फ्यूज. सो यू कॅन इमेजिन वॉट प्रिसिजन इज रिक्वायर्ड. सो एक हायटेक सर्जरी, बट ही हायटेक सर्जरी, so see, once upon a time, you doctor, I'm sure you must be remembering those days when we used to remove gallbladder and patients used to say I got 20 stitches, I got 18 stitches. म्हणजे they used to boast upon that. म्हणजे the time was that bigger the surgeon, bigger is the incision.
Correct.
हो एक काळ आशिल्लो जेन्ना लोकांक दिसतालें की व्हडलो दोतोर म्हणजे व्हडले इन्सिजन, म्हणजे व्हडले खूब टाके पडले. आमी म्हणटाले म्हाका 20 टाके पडल्या, म्हाका 22 टाके पडल्या. हे सांगतना आमकां एक गर्व महसूस जातालो, आमकां एक म्हणजे वॉर अशें दिसतालें. पण आज दीस बदलल्यात. आता मिनिमल एक्सेस सर्जरी किंवा लॅप्रोस्कोपिक सर्जरी बेसिकली हार्डली 1 or 2 stitches or sometimes even no stitch. Correct, doctor?
Yes, sir.
So what is the advantage of this laparoscopic surgery?
You are absolutely right, sir. So previously, in the previous era, at least 20 to 30 years before, when they were doing major surgeries, there used to be a sentence called a bigger surgeon with a bigger incisions.
Correct.
But right now, we are doing supra-major surgeries with very small incisions, like 10 millimeter or most probably 15 millimeter. So laparoscopic surgery, see, any technique, apart from medical or engineering, any technique has its own evolution phase. That it started with a small instrument and it has evolved into major technique. So that's how the laparoscopy technique started. In the ancient eras, when the doctors started using laparoscopic cameras, there used to be lenses and rods. That's how they started, developing the laparoscopic cameras. See, each laparoscopic has got many lenses inside. So that's how we see magnified view in the monitor.
Correct.
So what they used to do is, and there are also examples that in the ancient time, the laparoscopic surgery used to be done with the help of the lamp. They used to put on the lamp or even the candle, and they used to magnify with the help of total internal reflection, they used to see the internal abdominal organs, and they used to carry out the surgeries. Yes, there were complications earlier, but as the anesthesia part improved, so surgical part improved. So right now we are doing all major laparoscopic surgeries with very minimal complications.
Okay, so doctor, what you have rightly explained to us, that this is an evolution.
Yes, sir.
It is just, I can say it is evolution, it is a metamorphosis, because as earlier, so when we were taught in textbooks, as you have rightly said, all teachers, like a big teacher, good teacher means a person who is to give big incision. Now there's a paradigm shift.
Yes,
people, the person, like see डॉक्टरांचं सांगला एक लहान म्हणजे 10 ते 15 मिलीमीटर सांगला त्यांच्यानी, नॉट इवन सेंटीमीटर. प्लीज ट्राय टू अंडरस्टँड. मिलीमीटर म्हणजे एक साधं सहजसं येद्याशा बुराकातल्यान हे सर्जरी करप एक कौशल्य असतं, तितकेच ते जिकिरीचे काम असतं. त्याचप्रमाणे ते इट इज विथ ऑल न्यूअर सॉफिस्टिकेटेड इंजिनिअरिंग टेक्नॉलॉजी. लॉट ऑफ क्रेडिट ऑल्सो गोज टू द म्हणजे बायोटेक्नॉलॉजी आय शुड से. कारण ही जी त्यांच्यान तंत्रज्ञान आसा तातूंत आतां तांच्या डॉक्टरान सांगलें की पयलीं एक काळ आशिल्लो जेन्ना ते सोर्स ऑफ लायट म्हणून ते दुसरे वापरचे पडटाले, मेणवात आनी कितें. आज हे सगळें इनबिल्ट आसता आनी देर आर सो मेनी थिंग्स, सो मेनी मॉडेलिटीज, सो मेनी फ्लेक्शन्स अँड एक्सटेन्शन्स आर पॉसिबल विथ दीस लॅप्रोस्कोप. म्हणजे जे हातान करप शक्य जायनाशिल्लें ते आज लॅप्रोस्कोपिकली करपाक शक्य जाता. डॉक्टर,
Yes, sir. Yes, sir.
see, it has given I can say it was 360 degrees flexibility, if not exactly 360, but somewhere close to that.
It is possible with the robotic surgery.
Correct. So with this हे सगळें करताना एक महत्वाचो भाग जो आसा की see at this it is not a engineering gimmick which we want to market upon. Basically it is a technology which is supporting in the interest of the patient. So now let's talk about what are the advantages for the patient, doctor. As a patient, like see a person, now we have talked about the evolution, everything.
Yes,
now
sir.
see, earlier we used to do all this gallbladder and so many. Now practically there is no organ which is spared from laparoscopic surgery.
Yes, sir.
So it has reached everywhere. So you just highlight about what are the advantages for the patient.
Sir, as we already talked, sir, जब हम मेजर सर्जरीज करते थे इन अर्लियर एरा, तो पेशेंट को 10, 12 या 15 स्टिचेस लगते थे, एंड देयर यूज्ड टू बी लार्ज इंसिजन्स. सो पेशेंट्स को क्या होता था, पेन ज़्यादा होता था और दे couldn't stand from the bed for a few days, at least 2 to 3 days. So वो जब बेड पे पड़े रहते थे, there used to be certain other complications like chest में infection होता था, नहीं तो पाँव में blood clots होता था. So these used to be the complications in those time when they used to put a large incisions. But see, now we are doing major surgeries through the laparoscopy. All those complications have been minimized. अब क्या होता है, we do laparoscopic surgeries in the morning and we start mobilizing the patient in the evening. At least 6 to 8 hours we give rest to the patient, then we start mobilizing the patient so that the early recovery होता है, early discharge होता है. So these are all a few advantages. Many more advantages are like see, one, it's a like cosmetic purpose. The large incisions may tend to get infected, so scar बहुत it doesn't look very nice. So but laparoscopy में we put a small incision. Sometimes we may not see those scars. So cosmetology is very superior. Next, like जब भी हम मेजर सर्जरीज करते हैं, See, in our medical term, we call abdomen as a Pandora box.
Absolutely.
Like what happens is, हम एक diagnosis हमारे दिमाग में रख के we open the abdomen, but many a times we find surprises.
Absolutely.
So that's why it's called as a Pandora's box. So हम जब ओपन सर्जरी करते हैं तो वी आर फोकस टू अ सिंगल एरिया, बट हम जब लैप्रोस्कोपी सर्जरी करते हैं we see all the quadrants of the abdomen. So for example, whenever we take a patient for laparoscopic appendix surgery, preferably in a female patient, we can also see the internal organs like uterus, we can see ovaries, we can see. Sometimes क्या होता है कि yes, appendix will be inflamed, but along with the appendix there will be ovarian cyst. So ovarian cyst torsion रहता है.
Correct.
तो आप जब ओपन सर्जरी करते हैं तो you only remove the appendix. It's not possible to go into the pelvis and remove the ovary.
Yeah.
But laparoscopically it is possible. तो it's a extra added advantage of laparoscopic surgery. So next other advantages are, as I said earlier, early mobilization, early discharge from the hospital, then early resume to the work. So these are the few advantages of laparoscopic surgery, sir.
So just for translating the things for the convenience of our viewers, की दोतोरान सांगलें की लॅप्रोस्कोपिक सर्जरी हे तंत्रगिन्यान आयिल्ल्या कारणान पेशंटाक जो घावो पडटालो किंवा ऑपरेशनाचो स्कार जाका म्हणटाले की 12 टाके घातले 15 टाके हातून जे व्हडले घावो उरतालो किंवा हो घावो बरो जावपाक वेळ लागतालो किंवा ताचे कॉम्प्लिकेशन जाताले, इन्फेक्शन जाताले, ते कॉस्मेटिक म्हणजे पळयतना बरें दिसनाशिल्लें केन्नाय खंय तरी. म्हणजे आतां दीज आर डेज ऑफ स्पेशली गर्ल्स, तांकां कितें पोटार घावो आसा आनी खंय आसा अशें बरें दिसनाशिल्लें. हें सगळें ह्या लॅप्रोस्कोपिक सर्जरीच्या माध्यमांतल्यान पयस जालें. आणि फक्त अपार्ट फ्रॉम म्हणजे फक्त एस्थेटीक सेन्स इतकोच न्हय तर पेशंट बेगीन बरो जाता. जशें सांगलें की आज सकाळी ऑपरेशन केलें, सांज मेरेन पेशंटाक ओके मातसो तो चलपाक लायता, विदीन 2 days पेशंट इज बॅक होम. सो हाचो जो ताचो टायम जो आसा तो सेव जाता, तो पेशंट बेगीन बरो जाता, बेगीन रिकवर जाता. आनी हाका लागून ताचे बाकीचे कॉम्प्लिकेशन आसता. म्हणजे एखादो मनीस जेन्ना हॉस्पिटलांत एडमीट आसता ताचे बाकी इट इज नॉट वन मॅन शो. ताच्या बरोबर जे घरचे आसता, ताका कोण डबो दिवपाक, कोण हाडपाक, कोण ताचे बरोबर रावपाक, कोण ताचे बरोबर न्हिदपाक, कोण ताका हाताक धरपाक, ही जी सगळी टीम आसता ती सगळ्यां तांचोय टायम सेव जालो आणि यू आर बॅक टू युअर जॉब विदीन 1 or 2 days. दीस व्हेरी इम्पॉर्टंट पार्ट ऑफ दीस सर्जरी. दुसऱ्यान डॉक्टरान सांगलां की आज कशें आसा की जेन्ना लॅप्रोस्कोपिक सर्जरीच्या माध्यमान आमी समजा ताणें सांगलें समज एखादी चलयेक एपेंडिसायटीस जाला आणि एपेंडिक्स तुमी पळयतात जेन्ना लॅप्रोस्कोपांतल्यान आणि समजा एट द सेम सिटींग तुम्ही बाकीचे ऑर्गन्स म्हणजे बाकीचे सभोवताणचे भाग कशे आसा लायक सी ओवरी कशी आसा, युट्रस कितें आसा, खंय कितें प्रॉब्लेम आसा आणि समजा बाय चान्स एक्सिडेंटल फायंडींग सुद्दां मेळ्ळे जाल्यार तो त्याच एका एट वन गो यू कॅन मॅनेज बोथ द थिंग्स. म्हणजे ताका परत आनी एकदां ओवरीचें ऑपरेशन करपा खातीर किंवा ओवरीन सिस्ट आसा काडपा खातीर परत आनी सेकंड ऑपरेशनाक येवपाक गरज ना. वेरेज हें सगळें आमी जेन्ना ओपन सर्जरी म्हणटाली किंवा तातूंत हें शक्य जायनाशिल्लें. वेरेज लॅप्रोस्कोपिक इजी एक्सेसिबिलिटी आसता, हें सगळें पळयता. These are also advantages. Doctor, I just want to know very important fact.
Sir.
Because you also started your learning phase when we were taught about bigger the surgeon,
Yes,
bigger
sir.
the incision.
Yes, sir.
Then how you develop interest towards laparoscopic surgery?
सर जब भी हम व्हेन आई वाज इन द पोस्ट ग्रेजुएशन फेज तो मुझे भी पहले लगता था कि लैप्रोस्कोपी सर्जरी क्या है, एक कैमरा अंदर दे इंसर्ट इनसाइड द abdomen एंड डू द सर्जरी. आई वाज आल्सो लिटिल बिट अनकंफर्टेबल कि ओपन सर्जरी में क्या होता है, एक्सेस इज मोर.
Correct.
तो आप हाथ से इफ यू आर आई मीन
Yes, you can
स्किलफुल
feel it,
सर्जन,
texture,
हाँ सर,
everything.
you can touch the organs, you can feel the parts. But laparoscopy में ऐसा नहीं होता है. Whatever you have to do is you have to do with the help of
Correct.
instruments.
Yeah.
So part of my post graduation was we have to submit a thesis. We have to do a study in 3 years. So my topic was comparison of laparoscopic surgery versus open surgery
Oh.
in appendicitis.
Acha.
So see, I started assisting laparoscopic surgery slowly and I learned that coordination. आप जब ओपन सर्जरी करते हैं तो इट्स इन फ्रंट ऑफ यू, बट आप लैप्रोस्कोपी सर्जरी करते हैं तो यू हैव टू हैव अ हैंड आई कोऑर्डिनेशन.
Absolutely, absolutely.
जैसे कि बच्चे लोग अभी वीडियो गेम्स
Games,
खेलते हैं
video games.
तो इट्स जस्ट लाइक दैट. तो आप जब भी इंस्ट्रूमेंट्स, योर हैंड्स विल बी ऑन द इंस्ट्रूमेंट बट योर आईज विल बी ऑन द मॉनिटर. तो दैट कोऑर्डिनेशन आने में थोड़ा टाइम लगता है, बट वंस यू गेट दैट कोऑर्डिनेशन एंड यू स्टार्ट असिस्टिंग स्लो बाय स्लो, slowly द सुपीरियर सर्जन विल स्टार्ट गिविंग यू द चांसेस. सो दैट्स हाउ यू विल लर्न द सर्जरीज. तो मैं असिस्ट करता गया, मैं slowly आई स्टार्टेड डूइंग सर्जरीज. आई प्रैक्टिकली केम टू नो द एडवांटेजेस ऑफ laparoscopic सर्जरीज वर्सेस ओपन सर्जरीज. तो पेशेंट यूज टू स्टार्ट मोबिलाइजिंग अर्ली, उनका वुंड इन्फेक्शंस कम होता था, अदर कॉम्प्लिकेशंस नहीं आता था. तो दे स्टार्ट टू हैव लिक्विड्स अर्लियर, तो खाना जल्दी खाते थे. सो वी यूज टू डिस्चार्ज देम अर्लियर. दैट्स हाउ आई डेवलप माई इंटरेस्ट इन laparoscopic सर्जरी, सर.
And where you did your this super specialization?
Sir, I did DNB general surgery at Bhagwan Mahavir Jain Hospital, Bangalore, sir.
Acha.
And laparoscopic fellowship in VGM Gastro Center, Coimbatore.
It is one of the famous places which I heard of. So अशा जाग्यार शिकून करणाऱ्या डॉक्टरान म्हणजे सांगला की त्यांचा जो थिसीचो टॉपिक आशिल्लो तोच आशिल्लो की लॅप्रोस्कोपिक सर्जरी आणि ओपन सर्जरी हाची एडवांटेजीस कितें हे तांच्यांनी त्या वेळापासूनच त्यांचे लक्ष केंद्रित जालें अशें म्हणूं येता. डॉक्टर, वन मोर थिंग वीच वी हॅव नॉट फोकस अबाउट बट इज इक्वली इम्पॉर्टंट इज दॅट फायनान्स पार्ट. Because as you rightly said, once the patient remains in the hospital for a longer time, definitely his cost effective, I mean his bills, everything goes up because he require antibiotics, he require this, that.
Yes, sir.
Whereas once the patient is mobilized, there is lot of cost saving. म्हणजे ही एक अशी गरज आसा की फक्त जशें आमी म्हटलें पेशंटाक बरें दिसता हो एक भाग जालो, सर्जनाकूय जेन्ना ताचे एक्सपर्टायज जाता तेन्ना ताका तें आवडटा आनी ते इनफॅक्ट विथ लॅप्रोस्कोपी ऑल्सो नाव लॉट ऑफ न्यूअर एडवांटेजीस आर कमिंग. नाव यू कॅन गेट अ फील ऑफ दॅट. म्हणजे ज्या ऑर्गनाक तुम्ही टच करता, म्हणजे जसे आता डॉक्टर म्हणटाले की पयलीं आमकां दिसतालें की ऑर्गन ओपन केल्या उपरांत हात लायल्या उपरांत कळटा की घट आसा, मोव आसा. पण आता विथ लॅप्रोस्कोपिक डिवायसीस हॅव सच अशे इतके वर्सटायल आयला की यू कॅन गेट अ फील ऑफ दॅट ऑर्गन. सो हाचो सुद्धा एडवांटेज. सो हे सगळें पळोवन आयला की लॅप्रोस्कोपिक सर्जरी हॅज ऑलमोस्ट टेकन ओवर ओपन सर्जरी. करेक्ट डॉक्टर?
Yes, sir. Yes, sir. You are
सो
absolutely
आय
right.
थिंक अ डे हॅज, म्हणजे आय एम नॉट सेईंग हॅज टू कम, इट इज ऑलरेडी कमिंग. आता कितें आसा पण थोड्या खातीर दिसता की ओके आमी इतके वर्सां करत आयल्या, इट गोज ऑन वेल. बट आतां डॉक्टरान सांगला तेप्रमाणे लॉट ऑफ न्यूअर वर्जन, बिगर एनास्टोमसीस, दीस दॅट, गॉल ब्लॅडर स्टोन, माती, गोबर, हे सगळे जे कितके तरेतरेचे जी दुयेंसां आसा ही सगळी आज लॅप्रोस्कोपिकली हँडल करूं येता. डॉक्टर, वन मोर थिंग आई जस्ट वॉन्ट टू नो की वॉट अबाउट हर्नियाज एंड ऑल दिस टाइप ऑफ रिपेयर सर्जरी और एनास्टोमी, हाउ यू गो हेड विथ लॅप्रोस्कोपिक मैनेजमेंट इन दिस पेशेंट?
So usually hernia patients they come with swelling in front of the lower part of the abdomen. So in these patients we clinically examine and we decide which patient to go for laparoscopic surgery, which patient to go for open surgery. Then for example at Salgaonkar Hospital where I'm practicing now, so we have a team of laparoscopic surgeons as well as we have well established OT and laparoscopy instruments. So what we do is we prescribe a set of investigations and we ask our physicians to see these patients and categorize them for whether they are normal patients or risk patients. So then we try to involve our anesthetist. So usually the hernia surgery it is also evolved like a laparoscopic surgery. So hernia surgery में पहले open surgery was meant to be the gold standard treatment, but slowly that trend
Doctor,
is changing.
I'm just interrupting. I think
Yes,
we got a call. Hello.
हॅलो.
हाँ.
दोतोर, म्हजो प्रश्न आहा. आयपाक येता न्हू?
हय येता, विचार.
म्हणजे लॅप्रोस्कोपी करून गॉल ब्लॅडर काडला.
हाँ, व्हेरी गुड.
गव्हर्नमेंट हॉस्पिटलान.
हय.
आनी म्हणजे गॉल ब्लॅडर काडला
ऐकलें.
गव्हर्नमेंट हॉस्पिटलान.
हय.
हांव गेलें एक पाट गेलें आनी मागीर ती बरी नासतना आयलें. थोडी वर्सां जालीं. आनी आतां ते म्हाका मातशें केन्ना कितें म्हाका वाडटा म्हणून हांव त्या दोतोरा फुड्यान वयता. पूण कांय त्रास ना.
व्हेरी गुड.
लॅप्रोस्कोपी करून ऑपरेशन करपाक कांय त्रास जायना.
व्हेरी गुड. बरें दिसलें आयकून. बरं, तुजो आनी कितें प्रश्न आसा ह्या संदर्भान?
आनी आतां म्हजो एक प्रश्न म्हणजे आतां कितें हात तांबडी जाताय, 10 वर्सां भुरग्यांक तोंड तांबडें जाता, कितें दुयेंस येयला न्हू. होय आणि त्या काल न्यूज पेपर आलेला टमाटा वयल्या आणि कितें आयकला
बरोबर
आणि आता आणि थोड्या दिवसांनी म्हटले कांद्याचे
कशें आसा न्हय तशी दुयेंसां नवी नवी येत आसतली पण आयचो जो विशय आसा न्हय आमचो तज्ञ दोतोर आसा पण म्हाका खूब बरें दिसलें की दीस आर टेस्टिमनी फ्रॉम अ पेशंट हरसेल्फ. Patient said that she was operated for gallstone and I think cholecystectomy was done and she is very fine. म्हणजे आमकां पेशंटूच आतां सांगता की आज ह्या तरेची ऑपरेशन करून तिका बरें दिसलें, ती बेगीन बरी जाली, ती बरी आसा, तिका कांयच कॉम्प्लिकेशन ना, शी इज व्हेरी हॅप्पी. म्हणजे आज आणि दुसरी ताणें आनी गजाल इम्पॉर्टंट सांगलें की हे सगळे फॅसिलिटी आज सगळ्या हॉस्पिटलांनी अवेलेबल आसा. म्हणजे ताणें सांगलें की इवन दो शी वॉज ऑपरेटेड इन गव्हर्मेंट हॉस्पिटल, केएलईन वचून परत आयली आणि हांगा तेंच्यांनी करून घेतले आणि शी इज व्हेरी कम्फर्टेबल. सो वॉट इज इम्पॉर्टंट द सी वॉट वी आर बेसिकली आमी हायलायट हेंच करूंक सोदता की आयचें जें हें बदलतें जमान आसा किंवा बदलतें युग आसा ह्या युगांतली ही नवी टेक्नॉलॉजी it has to be supported, it has to be learned and it has to be accepted by the patients also. कारण हाचो जो एडवांटेज आसा इज अ ब्रॉड स्पेक्ट्रम. जशें सांगलें की तूं हॉस्पिटलान कमी दीस रावता, मे बी समटायम लेट्स टॉक अबाउट बाबा हॉस्पिटल गव्हर्मेंट हॉस्पिटल हें फुकट जाता, व्हेरी गुड. हां थँक्यू देव बरें करूं तुकाय बी तूं यो आमगे चवथीक. आनी हें सगळें करतना सी इवन प्रायवेट सेक्टर पीपल आसा दे आर ऑल्सो पुटींग दॅट फूल टेक्नॉलॉजी फूल सपोर्ट. कारण हाका लागूनच एक नवे तंत्रज्ञान उपलब्ध जाता, त्या लोकांक अवेलेबल जाता. आणि जेन्ना आमी गोंया सारख्या राज्यान उलयता, गोंय इज वन ऑफ द मोस्ट एडवान्स. म्हणजे आज गोंयाच्या राज्यान जी हेल्थ फेसिलिटी अवेलेबल आसा ती म्हाका दिसता आनी खंयच्याच राज्यान ना. सो फूल क्रेडीट गोज टू अवर डायरेक्टर ऑफ हेल्थ सर्विसीस, अवर हेल्थ मिनिस्टर, चीफ मिनिस्टर हांकां लागून. कारण हें सगळ्या लोकांक मेरेन तांच्यांनी पावयलां आणि ताचे कितकेशेच गव्हर्मेंट हॉस्पिटलांची जी फेसिलिटी आसा त्यांचे म्हणजे प्रायवेट हॉस्पिटलांनी सुद्दां जे बील गव्हर्मेंट भरता. सो दे नीड नॉट बी थंय वचून तुमी लायनीक रावचें पडटा. तर सो वॉट इज इम्पॉर्टंट की हें जें नवें तंत्रज्ञान आसा त्याच्या विशीं लोकांक एक जागृतकाय जावची, तांच्या विशीं एक अवेअरनेस येवचो. दे शूड ऑल्सो फील बाबा ओके चलो लेट्स गो फॉर इट. आणि रादर दॅन एनी हेजिटेशन सिन्स. आणि एक दुसरी गजाल जशें डॉक्टरान आतां सांगलें तो इतके पयस बेंगलोर शिकलो, तो कोइंबातूर शिकलो आणि नाव ही इज प्रॅक्टिसींग इन गोवा विथ हीज फूल टीम. सो अशा तरेच्यो फेसिलिटी आज गोंय राज्यान अवेलेबल आसात, तुमच्या दारा पर्यंत अवेलेबल आसात. तेन्ना एखादें दुयेंस जालें तें आंगार काडनासतना लायक सी फॉर एक्झाम्पल डॉक्टर आय वूड लायक टू टेक युअर ओपिनियन अबाउट एपेंडिसेक्टॉमी. या कारण हो एक कॉमन आसता. म्हणजे तरी आतां म्हाका खूब कमी जाला, मे बी बिकॉज ऑफ अवर एंटीबायोटीक इरा दीस एपेंडिसायटीस रेट हॅज गॉन lot of drastically down. At least appendicectomy, to be very precise, because appendicitis is still it is a major cause. But एक काळ आशिल्लो जेन्ना प्रत्येक म्हणजे एवरी थर्ड और फोर्थ गर्ल यूज टू सी की एपेंडिक्स काडला म्हणटाले. बट नाव दॅट इज नॉट अ सिनारियो. पण जेन्ना काडचें पडटा ताचो एक दुसरो एडवांटेज डॉक्टरान सांगला की हाचो स्कार उरना, की घावच कळना तुका कोणाचें लक्षान येना. पयलीं दिसतालें अरे हां तुजें एपेंडिक्स काडला, ऑपरेशन केला, कसलें ऑपरेशन केला, कितें केला, हें केला, तें केला, असे 1000 प्रश्न आसताले. आज तें कळना. सो डॉक्टर हाव यू मीन्स 2-3 थिंग्स which commonly practice about gallstone as this lady has already mentioned. Sir, I would like you to talk on that and also appendicitis.
Yes sir, sure sir. Sir, the gallstones basically it's a common problem. So it is more common in females around the age of 40 to 50 during their fertile period. So the reason for this are mainly unknown, and other reasons are like see the gallbladder itself doesn't have any other function. So the bile produced by the liver, so it's around 1 to 1.5 liters daily, and a part of the bile it comes and it gets deposited in the gallbladder. So rest of the bile it goes to the intestine through the common bile duct. तो gallbladder में जो भी बचा हुआ bile क्या होता है कि whenever we have food, so whenever the food is getting digested, there are production of some hormones. Because of the action of the hormones, the gallbladder gets squeezed and rest of the bile flows into the intestine to help the further digestion. So there are some entities called as supersaturation of the bile, or there is increased presence of calcium salts in the bile can give rise to stone in the gallbladder. So 70% of the time the bile stones will be asymptomatic, like silent stone. So patient will be having stones but still they won't have any symptoms. But rest 30%, these patients will have the complications related to the gallstones. क्या होता है? तो these gallstones, like, they will disturb the function of the gallbladder. So basically क्या होता है? The bile will not flow into the intestine. So whenever they have food, they feel there is some pain in the upper part of the abdomen, right side of the abdomen. तो कभी कभी ये दर्द it shifts to the shoulder, right shoulder,
अच्छा,
or goes to the back also. So this continues. Patients thinks that they have acidity problem and they'll try to take over the counter medications, and this will continue for a long time. So once this pain becomes intolerable, they'll come to physician or surgeon. They'll get a scan done. That's how the disease is diagnosed.
correct.
And see, other problems is that because of the persistent irritation of the stones, the gallbladder will get infected. So that time the patient presents with fever, pain ज़्यादा रहता है. तो like when we examine, हम जब when we palpate the right part of the abdomen, right upper part of the abdomen, they'll have severe pain, severe tenderness. So that's how we diagnose clinically that this patient has acute cholecystitis. So we ask them to undergo ultrasound examination, and we ask them to get a blood test done, so that we tend to see the liver function test कैसा है उनका. Ultrasound में are there any other risk factors? Like simple cholecystitis में क्या होता है कि gallbladder will be inflamed, अंदर stones रहता है, and other the complications like gallbladder will be much more thickened, and there will be collection of fluid in and around the gallbladder. So these are the things which we categorize them into complicated gallbladder.
अच्छा,
So basically here I want to highlight one thing, that whenever any person gets the pain in the right side of the abdomen or upper part, if it is going to right shoulder or the back part, so usually after the food, then they should not think that it is only acidity.
अच्छा,
It's like prevention, like preventing complication. See, they should get a consultation with a physician or a surgeon and get the imaging done, so that they diagnose it earlier and get treated earlier rather than going for complications.
करेक्ट. सो
So,
बेसिकली डॉक्टरांनी सांगलें की गॉल स्टोन जे म्हणटात की पित्ताचे खडे हे खूप कॉमन असतात. खुबशे फावटी ते अनडायग्नोज उरतात कारण आमकां तेचे विशीं कांयचे त्रास असो जायना. सो मे बी समटायम्स इट एक्सिडेंटल फायंडींग की तूं कितें तरी जाता म्हणून डॉक्टरा कडेन गेलो आनी डॉक्टरान अल्ट्रासावंड केलो आनी तुजे ते स्टोन्स दिसले. एक दुसरें अशें आसूं शकता की तुमकां जेवल्या उपरांत कितें तरी त्रास जाता, पोटान दुखता उजवे सायडीक, हे सायडीक, किंवा फाटीन दुखता, किंवा तांच्या उजव्या शोल्डराक दुखू शकता. अशा तरेचे जेन्ना तुमचे कडेन कितें त्रास जाता आनी डॉक्टर कडेन वता आनी डॉक्टर मागीर सोनोग्राफी सांगता किंवा अल्ट्रासोनोग्राफी म्हणटा आमी, ते केल्या उपरांत हे स्टोन्स डिटेक्ट जाता. आणि अशा वेळाचे असतात जे जर काय प्रॉब्लेम करना हे चडशे फावटी दिसता कॉमन फिचर्स. बट समटायम्स तांणी सांगलें की हे स्टोन केन्ना केन्ना त्रासदायकूय जावं शकता. तातूंत तांचो जो बायल जो फ्लो आसा, बायल ज्यूस, तो फ्लो ऑब्स्ट्रक्ट जावन बाकीचे त्रास जावपाक सुरू जावं शकता. ते पित्ताचे पिशवी आसा ती सुजू शकता, तितून खडे आनी इन्फेक्ट जावं शकता, आनी ताका लागून बाकीचे आनी वेगळे त्रास जावं शकता. पोटान दुखू शकता, उलटी आयिल्ल्या भशेन दिसूं शकता, जोर येवं शकता, अशे वेगळे तरेचे प्रेजेंटेशन जावं शकता. Doctor, one more thing I just want to ask you. As you rightly said, sometimes, this is like a little academic question. As you rightly said, sometimes, often these are undiagnosed or maybe accidental findings.
Yes, sir.
Okay. Now suppose a person is having no signs and symptoms, no problems at all. Okay. But maybe for some reason we have done some sonography and we come to know there are stones. Okay. Often these stones are multiple. Yes. Correct? Or maybe single also. Okay. Now what is your guideline or what is your criteria to decide whether the patient has to undergo surgical removal of the gallbladder? Right. That is my question. Because म्हणजे हा क्वेश्चन हो असं विचारता की तुम्ही खंयच्या स्थितीन असताना किंवा केन्ना केन्ना हो एकच खडो असू शकता, केन्ना केन्ना चड खडे असू शकता. मागीर खंयच्या वेळार तुम्ही ते गॉलब्लॅडर काडपाक जे ठरयता हाचे तुमचे निकश कितें हो म्हजो प्रश्न आसा डॉक्टरा खातीर.
So we all know that medical is it's like day-to-day learning.
Correct.
Like medical studies are day-to-day learning. Even if I am a surgeon, see, I still go back to my home. I still study for 1 hour.
Absolutely.
How to update myself. So what happens is, see, earlier when we started doing cholecystectomies, earlier when we started doing gallbladder surgeries in case of gallstones, we used to tell the patients that if symptoms starts, then only we will operate. Otherwise, we don't operate.
अच्छा.
But last 15 days, we have so many literature, we have so many studies done by surgeons in Europe or America as well as in our country. So what we have come to know that as the patient is younger, they tend to get complications more.
Faster.
As the patient is old, like if we diagnose a silent stone in a patient of age around 60 years, 65 years, see, we reassure them that it may not cause any problem.
Correct.
But younger patients with silent gallstones, they have, because big lifespan, definitely these stones tend to cause problems. So for them, we advise laparoscopic gallbladder surgeries.
अच्छा.
Even like as you told, sir, silent gallstones. See, we ask them other histories, like whether the patient is traveling to some remote areas, like for example army person, if he is going to a remote place where the acute facilities are not available, if he has these silent gallstones, we advise them to undergo gallbladder surgeries and to prevent a complication.
Correct.
So that's what, sir. So because of day-to-day evolving medical knowledge, so at present time, any patient comes with silent gallstones, we advise them laparoscopic surgeries. But what we reassure them is, it's not like they have to undergo surgery on emergency basis.
Correct.
They can take some time, they can make a research on that, and yes, in their free time they can get a laparoscopy surgery done.
Absolutely.
For example, sir, in our Salgaonkar hospital, we do laparoscopic surgeries on like it's like 1 day or 2 days hospital stay.
अच्छा.
Laparoscopic surgery, and we mobilize them earlier. We apart from the surgery, we also educate the patients. After surgery, what they have to do, what they don't have to do, what they eat, what they don't have to eat.
Correct.
So this is a part of educating patients also, sir.
Absolutely. सो डॉक्टरान सांगलें की सो दीस व्हेरी इम्पॉर्टंट थिंग म्हणजे हो प्रश्न एकेडमिकली इंटरेस्टेड आशिल्लो आनी ताची जापूय डॉक्टरान अतिशय सुंदर दिला. डॉक्टरान सांगलें की समजा एखाद्या मनशाक गॉल स्टोन आसा अशें कळ्ळें, अशें समजा तो सायलंट स्टोन, ताच्या खातीर काय प्रॉब्लेम अशें पेशंटाक जायना, म्हाका त्रास अशें जायना, पण स्टोन आसा, तो फातर आसा पित्ताशयाचे वातून पिशवेन. तर डॉक्टरान सांगलें की तो आमी जेन्ना व्हेन यू हॅव डायग्नोस इट, समज तुका दिसून आयलें जाल्यार तुमी मातसो प्लॅन्ड सर्जरी करूं शकता. म्हणजे कशें आसा, फाल्यां समजा आला लेट्स आतां आमी म्हणलें की चवथ आसा फुडल्या आठवड्यान, चवथ जाल्या उपरांत करुया, किंवा आनी कितें अशें बाबा आपल्या घरान कितें कार्य आसा तें जालें. पण समजा हो तुमी स्टोन तसोच दवरलो आनी टुमारो एट सम जंक्शन, समजा एक रातचे अचानक ताचे कितें कॉम्प्लिकेशन जालें पसून, देन यू हॅव टू गो फॉर अनप्लॅन्ड सर्जरी, इट इज एमर्जन्सी सर्जरी. अशें जावपाक ताका मेकळो सोडच्या पेक्षा जेन्ना तुमकां कळलां की देर इज सम कल्प्रिट इज देर, सो बेस्ट इज नॉट रिम ऑफ.
Yes, sir. Yes,
सो
sir.
अशा पद्दतीन ताका हँडल करप इज अ मच वायझर सोल्युशन देन वेटिंग फॉर द कॉम्प्लिकेशन्स टू occur. Doctor, one more question I have got.
Sir.
Suppose now there is a solitary stone, because this stone also can be of any size. Okay, now you tell me what can be the maximum size? Approximately. I'm not.
Sir, till today, sir, you don't believe, we have removed almost 3 to 4 centimeter size of gallstones. Okay. See, you may be thinking, we actually make a laparoscopy incision 1 centimeter. How they remove 3 centimeter stone?
Correct.
What we do is, sir, in these type of stones, so we insert an endo bag inside, and we put a stone in the endo bag and we crush it.
Acha.
So we take care that this part of the stone should not spill in the abdominal cavity. So through the endo bag, we take them part by part.
हेच हांव मातशें कोंकणीन सांगता, तुका कळ्ळें. इट इज व्हेरी इंटरेस्टिंग. डॉक्टर म्हटलें की आमी 1 सेंटीमीटरचें इन्सिजन म्हणजे बुराक करता, तातूंतल्यान 3 सेंटीमीटरचो फातर काडटा कशें. तर हें सांगतना ताणें सांगलें की आज टेक्नॉलॉजी इतकी एडवान्स आसा की जे लॅप्रोस्कोपिक इन्स्ट्रुमेंट ते वापरतात तातूंत एक बॅग धाडटा ते भितर, म्हणजे एक ल्हान पिशवी भितर वता, जशें आमी आंबे काडटाना किंवा तोरां काडटाना वता पळय तशें, आनी ते घालून ते कवर करप आनी मागीर तो स्टोन भितर फोडटप. तो फोडल्या कारणान ते बाकीचे कडेन ते कुडके पसरनात. तर आनी वेन तुमचे सगळें फोडून जालें आनी यू हॅपी दॅट आय हॅव अचिव्ड माय टार्गेट, मागीर ती पिशवी काडप, तातूंत सगळे ते बाकी पयलीं कुडके स्टोनाचे येतात. दिस म्हणजे 3-4 सेंटीमीटर सुद्धा असू शकतं. डॉक्टर, वन मोर प्रिझम्पशन इज देअर. आय एम जस्ट टॉकिंग ऑन बिहाफ ऑफ द पेशंट.
No,
If the stone is big, like say as you have said 3
Yes.
to 4 centimeters,
Yes, sir.
there are less chances for complication because it will not move out. It may just likely to remain static.
I understand,
Likely.
sir. Yes, sir. Yes,
But
sir.
if it is small stone,
Yes, sir.
there are more chances it will go into the bile duct. It may
Correct,
cause
sir.
obstruction.
Correct, sir. Correct,
If I'm
sir.
wrong, you can just correct
No,
me.
no, sir.
And
You are
can-
absolutely right.
So no, because patient also get sometimes they read sometimes because nowadays we have got WhatsApp
Yes, sir,
media,
yes, sir.
WhatsApp University is there, WhatsApp Vice Chancellor is there,
Yes, sir.
group admin is there. They give lot of advices. So if it is small stone, better to remove. If it is big stone, let it be. So what is your take on this, on size? Now let's talk only about the size.
Yes, sir. Sir, you've actually raised a very nice point. Nowadays, a person sitting in any part of the world, in fact, in any room in the world, they can access the other part of the world.
Absolutely.
Or knowledge. So it's in the hands because we have mobile, we have internet, we can access to any part of the knowledge.
Absolutely.
So the thing is, sir, when it comes to the size of the stones, so as a surgeon, we are always afraid of small stones.
Absolutely.
Because what happens is, as you told, sir, the small stones, they tend to migrate into the cystic duct or common bile duct, and they cause obstruction. So bile cannot flow from that. So bile go on getting stagnant in the liver, or it comes to blood. So that is called as a jaundice. So you have seen people with yellow eyes,
what we call
or high colored urine.
Yeah.
So these are the signs of jaundice. So in these cases, we have seen these cases also, sir. So when patient comes with all the symptoms of cholecystitis, and patients will have jaundice. So in that case, what we do is we do an investigation called as MRI or MRCP. So MRCP will confirmly tell us whether there is a stone in the common bile duct. So when we diagnose stone in the common bile duct, so we advise patient to get admitted, and we start them IV antibiotic as early as possible, because already there is a jaundice.
Correct.
And already there is an inflammation in the liver.
Absolutely.
And this infection can spread into the blood.
Absolutely.
They can go for sepsis early.
Yeah.
So once the antibiotic is started, then we take a help of our gastroenterologist colleagues, and they will do the procedure called as ERCP. It's nothing but we pass an endoscope up to the duodenum, up to the first part of the small intestine, and we identify the common bile duct opening. It is called as ampulla of Waiter, and from there they pass tubes or catheters, and they'll try to retrieve the stones. So once they retrieve the stone, the bile flow is automatically started. So slowly the liver infection will come down, and within 1 or 2 days we'll take up them for surgery, laparoscopic surgery.
Doctor, we got an online question.
Sir.
The question is like this: whether laparoscopic surgery can be put into practice for hyperacidity, reflux, esophagitis, and all this type of problems?
Yes, sir. Yes, sir. So there is a surgery, laparoscopic surgery, called as a laparoscopic descent fundoplication. So usually what you said about GERD, sir,
Yeah.
it's like a gastroesophageal reflux disease.
Correct.
So we have our food pipe. From food pipe, the lower part continues as a stomach. So at the junction of food pipe and stomach, we have a junction called as lower esophageal junction. तो इस जंक्शन में क्या होता है कि देर आर स्मूथ मसल्स इन दिस जंक्शन, दे एक्ट एज अ वन वे वॉल. तो जो भी हम खाना खाते हैं, इट फ्रॉम द इसोफेगस इट गोज इनटू द स्टमक एंड इट डजंट कम बैक, डजंट रीगर्जिटेट बैक बिकॉज ऑफ दैट वॉल. सो there are some conditions called as esophageal problems where the wall get loosened.
Acha.
Okay, so once this wall loosens, the acid tends to come up or regurgitate up.
Yes.
So that
Reflux.
is called as a reflux esophagitis.
Yes.
So stomach has its own property to prevent acidity related injury, but esophagus doesn't. Esophagus doesn't have those protective mechanisms. So there will be burn injuries, burn ulcers forms in the our food pipe. तो पेशेंट को जलन होता है, तो हाइपर एसिडिटी लगता है, और दे में आल्सो प्रेजेंट विथ रेस्पिरेटरी प्रॉब्लम्स,
अच्छा।
लाइक ब्रीदिंग के लिए डिफिकल्टी हो रहा है. सो इन दीज केसेस, so see the first and foremost the investigation is upper GI endoscopy sir. तो एंडोस्कोपी में हमें पता चलता है कि वॉल्व कितना लूज है.
अच्छा.
So we grade it like grade 1, grade 2, grade 3, grade 4. तो depending on the grading and also depending on the other test called as a pH manometry. So we tend to diagnose which patient is for medical treatment and which patient is for surgical treatment. So usually sir, see patients, they once they diagnose a surgical condition, they'll become panic.
Correct.
That as soon as if the patient goes to surgeon, they ask them to get admitted and to undergo surgery. It is not like that, sir. So these are all functional surgeries. Yes, for acute appendicitis or hernia complications, so surgeries are inevitable. Surgery has to be done to cure the treatment. But like gastroesophageal reflux disease, these are all functional problems. So in functional problems, we always tend to reassure the patient. We try to find out what is the triggering factor. For example, the patients will be having the untimely meals, or the patient will be having certain habits which tend to increase the acidity, or the patient it can be hereditary also. So we reassure them, we try to educate them to maintain their lifestyle, healthy lifestyle, and that to have timely foods. And initially we give them medications to prevent the hyperacidity or reflux. So many of them once they start their lifestyle, healthy lifestyle, or some physical activities, they tend to have a lesser and lesser symptoms. But there are certain population of patients which may not get a relief. So in those patients the surgery becomes inevitable. So what we do, sir, basically we do laparoscopic surgery in this case, and we create a new valve.
Achha.
Like the upper part of the stomach, we wrap it around the lower part of esophagus. It's around full 360-degree wrap. So it creates a new wrap, or it creates a new valve. So this will definitely help the patient to relieve the symptoms. Yes, sir.
So basically, it is basically this is a conservative management can be tried.
Yes,
if
sir.
at all it fails,
Yeah,
and if
then
the
only
patient
the-
doesn't respond, and if the problems are more severe or more triggering,
Yes, sir.
then we can go for laparoscopic correction. So in short, this laparoscopic correction is possible. in
Possible, sir.
surgery.
Possible,
One
sir.
more question, doctor, I got online is that what is the role of laparoscopic surgery in case of piles and fissures? Is there anything possible?
Sir, we have to, sir, what we have to understand is laparoscopy is meant for abdomen, sir.
Correct.
So for piles, fissure and fistulas, we have a recent advanced treatment. It is called as a laser therapy.
Achha.
तो इसमें क्या होता है सर? So we use a laser beam, which is nothing but a strong beam of light, amplified light, to either destroy the tissues or to char the piles tissue, so that the piles get shrink. The size of the piles will get shrink, so that slowly that wound also will heal, and patient will not have bleeding.
Achha.
So usually, sir, there is a piles patient. They present with painless bleeding. Patient will not have any pain, but still they used to have typically they will tell that the fresh blood is splashed in the comet. So we examine these patients. We will categorize them like grade 1 hemorrhoid, grade 2 piles, grade 3, grade 4. So usually, sir, all patients with hemorrhoids shouldn't go for surgery. It's like basically what I told earlier. So first we try with conservative treatment, and if the conservative treatment fails, then laser surgery.
Achha.
So laser, we actually doesn't call it as a surgery, we call it as a lunch hour procedure.
Oh.
Like laser has many advantages, sir. Previously for files they used to do the conventional surgical treatment.
Yeah.
Like we excise the pile mass
Yeah.
and we put the sutures.
Yeah.
But in laser it is not like that, sir. We have a very small minute probe which emits a laser beam and we pass it in the hemorrhoidal mass or piles mass and we char it from inside. So that there won't be any wound outside. We don't put any sutures. And as I said, it's a lunch hour procedure. That's like a daycare procedure. Patient comes in the morning and goes back in the evening.
डॉक्टर आय विल जस्ट लाईक टू इंटरव्ह्यू
Yes, sir.
एक इम्पॉर्टंट खबर डॉक्टर आमकां सांगल्या विच इज व्हेरी इम्पॉर्टंट कारण ह्या कार्यावळीच्या माध्यमांतल्यान लोकांचे कांय बरेचशे गैरसमज आसा ते आमी पयस करपाक जाय की बऱ्याचशा लोकांक अशें दिसता की पायल्स किंवा जे हेमोरॉइड्स आमी म्हणटा ताका ॲलोपॅथीन ट्रिटमेंट ना हो चुकीचो समज आता डॉक्टरान सांगला की हाका एक इतकी बेस्ट ट्रिटमेंट मॉडलिटी अवेलेबल आसा विच इज लायक अ लंच अवर म्हणजे तुम्ही हॉस्पिटल ॲडमीट सुद्धा जावपाची गरज ना इट इज जस्ट लायक यू आर कमिंग म्हणजे तुम्ही ब्रेकफास्टाक आयल्या भशेन च्या पिवन जेवन गेल्ल्या भशेन ते त्यांनी सांगले लेझर प्रॉक्टोलॉजी ताणें सांगलें की त्यातून एक फायन लेझर म्हणजे पॉवरफुल बीम वता लायटीचो दातूंतल्यान ते पायल्स टिश्यू असता तो कवर करता ताका तो ताचे ब्लिडींग स्टॉप करता आनी तो बर्न करता आनी हाचे फायदो इतको आसा की हांव मुद्दाम कित्याक खातीर सांगता कारण आमी जेन्ना न्यूज पेपर पळयता किंवा रस्त्यान भोंवताना वचत ते बोर्ड मारिल्ले असतात विच आर बेसिकली मिसलिडींग म्हणजे हांव कोणा बद्दल वायट अशें सांगना पण ह्या पेक्षा ॲलोपॅथींतली स्टँडर्ड ट्रिटमेंट आज अवेलेबल आसा ती योग्य प्लेसींचेर अवेलेबल आसा ती तुमी करून ताचो योग्य पद्दतीन फायदो करून घेवंक शकता माय डॉक्टर रायट
Yes,
की वॉट आय एम ट्रायंग टू टेल देम की नाव देर बिकॉज वन्स ऑफ पीपल इज टू फील दॅट दे नो ॲलोपॅथिक ट्रीटमेंट दे शू ऑलवेज गो टू ऑल दिस क्वॅक्स अँड ऑल दिस
Yes, sir.
नॉनसेन्सीस
Yes,
अँड दे टू get themselves complicated rather than treated. I should, though I'm using the word judiciously,
Correct.
because I have seen so many patients, they have complicated issue and then it becomes unbearable, intolerable.
Yes, sir.
So, आज ही फॅसिलिटी अवेलेबल आसा ताचो फायदो तुम्ही करून घेऊ शकता डॉक्टर वन मोर क्वेश्चन आय गॉट
Sir.
द क्वेश्चन इज बेसिकली what is the correlation between acidity and hernia? I think maybe they are again referring to the same herniation of this thing, but I want you
Okay,
to
sir.
address this.
Sir, there are hernias called as a hiatus hernia.
Yeah.
So, see, usually when we say it is a hernia, we always tend to tell there is a swelling in the abdomen, swelling in the lower part of the abdomen. But what I mentioned, the hiatus hernia, it is the herniation of part of the stomach internally. So we don't find any swelling outside. It is basically a diagnosis from the endoscopy, sir. So when we pass the endoscope, so we will come to know whether there is any internal herniation, like what I said, hiatus hernia. So hiatus hernia में क्या होता है, sir? Upper part of the stomach, it gets herniated into the gradually inside the chest. So we have seen extreme cases where the almost the upper part of the stomach has come into the chest.
Acha.
So usually these patients will present with intractable reflux, sir. They will have many episodes of reflux since morning, and they will have a sleepless nights because of the reflux. So in these cases also, when we diagnose hiatus hernia, we'll rule out certain things by doing imaging things. Then in these cases also, extreme cases, these are also possible to correct by laparoscopic surgery, sir. So that's how the laparoscopy is evolved nowadays.
बरोबर डॉक्टरांनी सांगलें की हे हायटस hernia हो जो प्रॉब्लेम आसा तातूंत एसिडिटी आमी साद्या भाशेन म्हणटा की एसिडिटी प्रॉब्लेम ते केन्ना इतके सिवियर आसूं शकता की ते हर्नेशन जावन जो पार्ट सकयल म्हणजे पोटांतलो भितरलो पार्ट त्या बुराकांतल्यान परत वयर येता रिफ्लक्स येता ताचो आनी ताका लागून कितलेशे प्रॉब्लेम जावं शकता वेदर आनी सेकंड थिंग म्हणजे लॅप्रोस्कोपिकली दीस थिंग्स कॅन बी मॅनेज एट इज इन अ कम्फर्ट झोन डॉक्टर वन मोर क्वेश्चन आय गॉट इज दॅट how far is the safety profile of laparoscopic surgery?
Yes, sir. That's definitely a very good question.
Very good question.
So basically, when we admit any patient for surgery, we categorize them into normal patients, risk patient, or extreme risk patients. So I'm not going exactly by book, but I want to give some idea about this.
Rough idea.
So rough idea. Yes, normal patients like without any premorbid conditions. These patients will not have any medical conditions like diabetes, hypertension, or any cardiac risk, as well as no blood related problems. Okay, so when we come to risk category, like we again tend to categorize them. Grade 1 risk, grade 2 risk, grade 3 risk. See, this risk category is categorized according to American College of Anesthesiology, sir. तो क्या होता है कि सर grade 1 में so first we take a age category, like age is more than 40 to 45, or if the patient is suffering from the cardiac problem, or patient is suffering from hypertension or diabetes, so we would like to investigate them. We want to see whether the cardiac problem is under control.
Correct.
Whether the hypertension is under control with the medications, or whether the diabetes is under control with the medications. So that's how. So grade 1 means usually all the controlled risk factors with controlled.
Yes.
And grade 2 is patients will have premorbids, patients will have diabetes, hypertension, or cardiac related risk factors, but moderately under control.
Yeah.
And
So-
extreme risk is like even with the medications patient will have problems.
करेक्ट. सो बेसिकली आमकां प्रश्न आशिल्लो की हाव सेफ म्हणजे ही लॅप्रोस्कोपिक सर्जरी कितपत सेफ आसा, कितपत सुरक्षीत आसा. हाचें उत्तर हांव डॉक्टरान आतां बरें सुंदर तरेन एक्सप्लेन केलें, बट आय विल पुट इन अ नटशेल. कॅन यू आन्सर अ सिंपल क्वेश्चन, वीच व्हेकल इज सेफ ऑन द रोड? खंयचेच व्हेकल सेफ अशें आसना. एखादे समज तुम्ही स्पीडीन आता, यू मे बी गोईंग बाय मर्सिडीज और मे बी BMW, बट सपोज इफ यू आर ड्रायव्हिंग रॅश अँड इफ यू हिट बिगर इम्पॅक्ट इज हाय, डेफिनेटली अ पर्सन विल बी इंजर्ड. आता इंजरीचे मातशे लेवल कमी जास्त जावं शकता, पण प्रॉब्लेम आसाच, रिस्क आसा. पण ताचे अनेक गोष्ट महत्वाचे म्हणजे अगेन इट इज अ कन्क्लुडिंग स्टेटमेंट आय वुड लायक टू से, इन अ सेफर हँड्स a person who has it is initially I made a statement, right looks left and left looks right. It is not so simple. हे सगळे कोऑर्डिनेशन जसे त्यांनी सगळे व्हिडिओ गेम्साचेर करता तशें करप आसता, आनी हाका एक एक्सपर्टायज लागता. इट इज नॉट जस्ट यू आर स्टार्टिंग टुडे एंड टुमॉरो यू आर गोइंग टू डू लॅप्रोस्कोपिक सर्जरी, आज गॉल ब्लॅडर काडले, फाल्यां अपेंडिक्स काडले, परवा आनी कितें काडलें, अशें जायना तें. इट इज युअर एक्सपर्टायज. तूं हें अभ्यासांतल्यान शिकता. दॅट्स वाय. आनी डॉक्टर आनी एक उदोड सांगलें वाक्य की वी आर ऑल लर्नर्स. सी प्रॅक्टीस, सो दॅट्स वाय इट इज कॉल्ड मेडिकल प्रॅक्टीस. हें करून जेन्ना तूं हळू एक्सपर्ट जाता तेन्ना जेन्ना तूं आपल्या पद्दतीन तें सेफली हँडल करपाक तुवें तांक येता. इट इज एबिलिटी. Experience is not the number of years passed by, but it is the ability to meet the challenges ahead.
Yes.
की तुम्ही कितकी वर्सां प्रॅक्टीस करता. अगेन दॅट इज इम्पॉर्टंट थिंग. वी ऑफन फील दॅट practice makes a man perfect. No, practice doesn't make a man perfect. Only the right practices makes a man perfect. Wrong
Okay, absolutely,
practices
sir.
can lead to disasters. म्हाका दिसता हे काय महत्वाचे टिप्स आसात आनी हे सगळे घेवन डॉक्टरान सांगले. आनी परत आनी एक गोष्ट आसा की जेन्ना आमी लॅप्रोस्कोपिक सर्जरी विज ओपन सर्जरी हें जेन्ना आमी मेजर करून पळयता तेन्ना डेफिनेटली लॅप्रोस्कोपिक सर्जरी गिव्स अ बेटर एडवांटेजीस. सो सी आमी खूब विशयांचेर उलयले. आमी फायनान्स उलयले, ताचे हॉस्पिटल स्टे उलयले, ताचे कॉम्प्लिकेशन्स उलयले, ताचे मॉर्बिडिटी उलयले, वेदर ही कॅन जॉइन हीज ड्युटी फास्ट. हे सगळे कितलेशेच जर आमी अशें वे करत म्हणजे वजन करत जाल्यार लॅप्रोस्कोपिक सर्जरी हॅज अ बेटर एडवांटेजीस इन कंपॅरिजन टू द ओपन सर्जरी.
Yes.
म्हाका दिसता डॉक्टर, we are almost on a concluding watch. You would like to address anything, or I should say bye to our patients and wish them Ganesh Chaturthi?
Yes sir, yes sir, definitely sir.
सो आमच्या सगळ्यांच्या वतीन आता येवपी जो आमचो शुक्रार आसतलो तो आमी तुमच्या घरा आसतले चवथी खातीर येतले नेवऱ्यो खावपाक. तुमी तयार करात, सगळं तयार दवरात, देवाची भाव भक्तीन पुजा करात. तुमकां खंयची दुयेंसां जावं नये अशें आमी पयलींच तुमच्या सगळ्यां खातीर मागता. ताच्या फुडल्या जो शुक्रार आसतलो तेन्ना आमचे कडेन असोच एक एक्सपर्ट डॉक्टर आसतलो आनी ताचे विशीं तुमकां आमी जाणविकाय दितले. आनी परत सांगता की हॅलो दोतोर हे कार्यावळींतल्यान फक्त गोंयचेच दोतोर न्हय आनी फक्त एलोपथींतले न्हय तर तरेकवार फिल्डांतले एक्सपर्ट डॉक्टरां कडेन तुमचो वार्तालाप जातलो. बरेचशे नवें शिकूंक मेळटलें. सी एका खंयच्याच ज्ञानाच्या क्षेत्रांत हें ज्ञान मर्यादीत उरना. तर आमी नवें शिकप, नवे मॉडेलिटीज जे आसतल्यो त्यो लोकां मेरेन पावप आनी नवे तंत्रगिन्यान आत्मसात करप, नवे विचार घेवन हेल्दी लायफस्टायल घेवन फुडें वचप. तुमकां सगळ्यां कडेन गणपती कडेन तुमच्या सगळ्यां खातीर बरी भलायकी मागून आयची कार्यावळ सोंपयतना तुमकां सगळ्यांक काळजांतसान देव बरें करूं. नमस्कार.
Namaskar.
अँड नमस्कार. थँक्यू डॉक्टर.
Thank you sir.
तुम्ही पळयतात प्रुडंट.